Hi, everyone. Thank you for joining us for another Climax After Dark. We have Dr. Sadaf here, I'm so excited to have her here with us today. She is an intimacy coach and gynecologist. Thank you so much for agreeing to be part of the broadcast with us today. Um, so you all know this is live. You all know I'm a mom. You all know I'm a wife. I'm a gynecologist, but mom first. So you may hear some noises in the background that you're wondering what's happening. We're live and I'm living life. So I'm glad that all of you could join us tonight. So Dr. Sadaf, thank you for being here.
Yeah. Yes. Thank you. Oh, go ahead.
So I really personally, before we even start with what our conversation today is, which is the different types of intimacy, I really want to know, how did you get into this field of medicine, this field of sexual health?
Yeah. So, I just for your listeners and actually for your viewers that may not know who I am, my name is Dr. Sadaf Lodhi, and I am an OBGYN based out in New York. And I do OB and GYN currently, and I also do telehealth with gynecology, and I'm an intimacy coach and sex coach. So the way that I got into sexual medicine is because I found that there was a huge void in our training. I don't know about you, but I know for me and in my training, in my 4 years of residency, we never learned anything about sexual medicine. We learned about obstetrics and gynecology and pathology and cancer and all of this stuff and pregnant women and delivering women, but we never really learned anything about sexual medicine. And, I would have patients that would come and ask questions, and I wasn't really sure, except for just kind of going based on what previous patients had done or what I had seen or read. I didn't really have a firm grasp on sexual medicine. So I actually took a course through the University of Michigan for a whole year on sexual counseling and education. And so actually I am a sexual counselor. And I also did coaching through Rutgers. And so that's how I became like this intimacy/sex coach.
I definitely agree with what you said. The unfortunate thing is that in residency, we did not, to your point, get a substantial amount of training in sexual health, sexual medicine, which, is a very unfortunate thing. You would think that being women's health experts, because that's what we are, that would have been a large part of our education. But also as physicians, we didn't get that large, at least I didn't, in school. And I think I went to a pretty good school we learned a lot about connecting as people and to connect with people, but we didn't get a large education in sexual health. So seeking that education after post formal training, I think that's amazing, because there's a big need.
Yeah. Yeah, I agree. And I agree with you. In medical school, I didn't get much. We learned like a few hours about the Masters and Johnson research that they did in the 1960s on old white men.
Mm-hmm.
And, women are not old white men. Women have their
Mm-hmm.
own sexual response that, I only learned after I started to take the course in the class and learned there's a whole female sexual response cycle that was developed in 2001 by Rosemary Basson, and how arousal and desire and everything is affected, and how whether or not women are interested in sex has to do a lot with kind of what's going on in their life, their biopsychosocial model, and all of this stuff. So there's a lot more to it than just orgasm and plateau and excitation and all that stuff that they describe according to Masters and Johnson.
And do you find it interesting also that that's just the description that was given then to the sexual response system? I mean, because if you really think about it, sex and response to sex, both for women and men, is much more complicated than that.
Yeah,
so
absolutely.
I've always wondered, how did they distill it down to, okay, these are just the components? Like, were they actually having sex themselves, or being in sexual relationships and understanding like the complexity that was there,
Yeah. So their research, from what I understand, is they actually watched people and had volunteers participate in sex. And that's how they did their research. I could be mistaken, but I'm pretty sure that that's how it came about. And they did rehab. And, that's how they kind of came up with their four-tiered sexual response. And not much research had been done until more recently, where people came up with the idea that women were more complicated, and that they had a different sexual response than men, and that there were a lot of other factors that are that go
Mm-hmm.
into it.
Mm-hmm. Yeah. Yeah. And I don't know about you, but that's one thing that I think a lot of people understand innately, but find surprising when you talk about it. Like you just said, for women, most of the challenges that you may find that you have in the bedroom are because of things that are happening outside of the bedroom.
Oh my God. I say that all the time, that
Mhm,
whatever is happening outside is coming inside, and
mhm,
you cannot separate the two.
mhm,
And exactly what you're saying.
mhm. Yeah, yeah. Well, so let's get into what we're talking about tonight. Different types of intimacy. Um, so there are many types of intimacy other than sexual intimacy, right? And
Yeah.
I find this topic very interesting and also very very freeing too. When I have these discussions with patients and we really delve into it and start to talk about the types of intimacy, um, again, I find that there's a lot of surprise, and maybe that's because we don't have these deep conversations. So, what are your thoughts on the different types of intimacy?
Yeah. So there are definitely lots of different types of intimacy. The one that most people, right, find synonymous with intimacy is the physical intimacy, which is,
Hmm.
sex, sexual intercourse, different types of sex. And that I would relate to more with physical intimacy, which we know can also mean like holding hands, eye contact, touch, sexual relationship, right? But there's also like emotional intimacy, where you
Hmm.
establish trust in your relationship through honesty, and then you learn to share your innermost feelings and form a type of spiritual connection with your partner. Then you also have like an intellectual type of intimacy, where you're communicating your likes, your wants, your desires, your dislikes, and you're connecting to the exchange of ideas or a discussion with your partner. And also the type of intimacy where you're creating time and prioritizing time for each other, right? So that can mean like, say, date nights, and create experiences together and do activities together and have things in common. And I know that a lot of people really balk at the idea of having date nights, but that time, a lot of times when people are so busy, right? Like you were saying, you're a mom, you have children, you have a job, you're very busy, you're very successful. And so then a lot of times our partners kind of get lost in the mix, right? And
Hmm.
so we don't really make time for them. So when you start actually creating time, right? So for anything that's important in our lives, we tend to write it down, or we create that time, like, for example, we're working, so it's from 9 to 5, right? So that time we know is dedicated to work. So that's why it's so important to actually create that time also with our spouses, with our partners, because then we know that, at this, like, every Tuesday night at 7 p.m., I'm going to have a date night with my partner, right? With my husband or whoever that is. And that time is going to be exclusively for that. And I'm going to like silence my phone. I'm not going to answer messages. I'm not going to answer texts. I'm going to be really present in that relationship. And I feel that when people actually do that, when they're more mindful in that
Hmm.
relationship during that time, then that actually, studies have shown that just being mindful in a relationship actually increases your desire and increases arousal in that relationship. So a lot of times women will ask me, like, how can I increase my libido, increase my desire? And one of the key ways to do that is just through mindfulness.
Yeah, I mean that's I think you know an easy step, or it's a simple step to say, not something that you would first think about. Because to your point, I think many people may think, okay, to increase that sexual intimacy in my relationship, as opposed to exploring mindfulness of being mindful of my partner's presence. Let me be
Yes.
mindful of how I look, or the setting of the room, or the location that we are. And to that to a degree, yeah, I think does definitely help. But being mindful of your person, your special person's just state of being, because then that makes the other person feel seen and heard, and then that's
Absolutely.
that the other connections that you're talking about, other levels of intimacy start to play a role there.
Absolutely, absolutely right. Because we know that mindfulness is just being present in the moment without judgment, right? And so,
Hmm.
if you can be like that with your partner, right, and really show them that you are just focusing on them, and they're so important that you've dedicated this time for them, and it's all about them, that is going to definitely increase that emotional intimacy, which then eventually leads to physical intimacy, right? It's hard
Hmm.
to be, and I think especially for women crave that emotional intimacy. Not all women, but most women do. And so when you have that emotional intimacy, it does help a relationship in terms of the physical intimacy part of it.
So you have emotional intimacy, right? How
I'm
important would
sorry.
you say? So let's say you have that emotional intimacy, that
Mhm.
emotional connection, even though we're having our connections kind of waxing and waning.
Yeah.
But you have that connection. How important would you say then sexual compatibility is to um, sexual intimacy, to romantic intimacy? Are they different?
Yeah. So, there's, I know what you're talking about. You're talking about in a romantic relationship. So, there's really no definitive or authoritative answer to this. It's in
Hmm.
general, sexual compatibility can enhances and strengthens your relationship. Of course, some people, you and your partner can have differences, which is natural. But I think one of the most important things is to really have that open communication, right? To be able
Hmm.
to talk about what it is that you want, your needs and your desires, and what it is that you really like. And so there's been lots of studies that have done. There's one called the Female Sexual Satisfaction Survey.
Hmm.
And when
Hmm.
they asked respondents what was the number one thing that actually helped them be more sexually satisfied, what they noted was that communication came up over and over again. And
Hmm.
so it really is the key thing to anyone's sexual satisfaction. And I would say, even to the sexual compatibility, right, is
Hmm.
really the ability to have deep conversations with your partner, to let them know what you like, what you don't like. In fact, I just had a patient today. I was seeing her in the clinic, and she was telling me that it was her anniversary today, and the MA and I were just really happy for her. We're like,
Hmm.
oh, congratulations. She said she'd been with her partner for 40 years. But the sad
Wow.
part about it is that she said that she really wasn't excited and wasn't looking forward to tonight, because she knew that there were certain expectations for her on their wedding anniversary, and she just was not interested in having
Yeah.
that physical relationship with her partner, because she said that he doesn't listen to her,
Yeah.
that it's all about his needs and his wants and him being satisfied, and he never takes the time out to talk to her and talk to her about her satisfaction and her desire. And so because of that gap in their relationship and their inability to communicate with each other, she wasn't even excited about their
Hmm.
anniversary, which I thought was really sad, to be with somebody for so long and to really not enjoy, their company.
So then, if I'm walking in and I'm her, you know, what would you tell me? Because this is not an uncommon conversation, right? We talk about communication is key. We need to communicate. We need to talk about our desires and our boundaries to our partner that we have dedicated ourselves to through marriage or any type of commitment. But there's that challenge in personality. There's that challenge in conversation, and maybe there's some fear there. Maybe there's some
Mhm.
anxiety. Maybe there is some resentment, but you're
Yeah.
still here. You're still a partner. So,
Yeah.
how would I communicate to my partner? This is what I want when I see that you're pretty selfish, right? Or
Yeah.
what I'm deeming as pretty selfish. Because on his end, it could be he's just really not aware. He's just, he's just not. He's just really not aware.
Yeah. Yeah. So, first and foremost, what I would do in that relationship is I would assess what my thoughts and my feelings are, right? How
Hmm.
do I feel about the situation? Because if you go into a relationship and you're going to have a conversation with somebody, but if you already have that resentment and anger toward that other person, then that conversation is going to be really charged. And it
Yeah.
may not end up the way that you want it to end up, right? So you may be thinking that, I'm going to have this conversation and I'm just going to be really honest, but maybe they're not ready for that conversation. So what I would do is I would try to create time again, right, in my day. Maybe it's at the end of the day. Maybe it's at the
Hmm.
time where both of you are decompressed. Maybe it's the time where, you know, you are you have 10, 15 minutes that you put in your calendar to have just a conversation at night, right? It could be about anything, but slowly you work up that conversation to, your intimacy or your sexual relationship and what you like and what you don't like, right? It's kind of like feeling the room and kind of getting a sense of what's happening and what's not, and being also in tune of your feelings, right? So
Hmm.
going at that, having that conversation when you yourself are calm and you're collected and you know what you want to say and you know your feelings, right? A lot of coaching has to do with understanding your thoughts and
Hmm.
realizing that we have a choice. We get to choose our thoughts. We have so many thoughts that go through our mind every
Hmm.
single day. And so to realize that, if I'm having a certain thought, like I'm thinking in my head that, he's being very selfish, right? So, what is the feeling that's going to come out from me having that thought? It's going to be resentment, right? Or anger.
Hmm.
And then if I'm feeling resentful or angry, then I know that my action that's going to come out, maybe I'll speak in a very negative tone. Maybe I will stonewall him. Maybe I just won't talk to him. Maybe I will use sex as punishment,
Yeah.
right? Like, so
Yeah.
not have sex because I'm angry with you. I'm resentful, and I'm just going to hold that and, not
Hmm.
engage, right? And so the important thing with coaching and what I do in coaching is that, I start with the thoughts, right? So how can we change our thoughts so that they serve us? How can we, instead of having the thought that he's very selfish, maybe change that thought to, I understand that he's, maybe he's busy or maybe whatever, maybe I need to help him understand what I want. So let's,
Hmm.
start back from there, right?
Hmm.
And so there is something called positive intelligence, where it's
Hmm.
a whole coaching method by this man. His name is Shirzad Chameen. And he talks about how in everything that happens to you, there's something positive that can be taken away, right? So maybe trying to navigate and trying to find a way that you can change that into a positive narrative. And I'm not talking about toxic positivity, but just something where your thought can be more neutral and maybe
Yeah.
not angry, right? So nobody's saying that you have to love it, but just maybe, not be so angry, so that when you come off, when you're having that discussion, when you're communicating, you're not coming off as if you're angry, but just maybe from a place of curiosity, and just talking to your partner, like, and where you have set up the time of maybe 15, 20 minutes to talk to them every single night. So it's something that you both do, right? You just have a conversation. It could be anything, family, about life, whatever, but that you start setting aside time to have that communication. And then you come from a place of curiosity instead of
Hmm.
anger, and start
Hmm.
asking more open-ended questions like, well, I see that, when we are intimate with each other, when we're having sex, my pleasure is not as important to you, at least it seems, as perhaps your pleasure is. Maybe, let's talk about that. What do you think? How do you feel about that? Have you thought about this? Whatever. So just coming from a place of just curiosity, I think, just changes the tone of that whole conversation. So it's not like anger and resentment, but more of like, trying to understand, maybe more one of compassion, where you're showing compassion to each other.
So more like open-ended questions than accusatory questions. You
Yeah.
know.
Yeah.
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 I think, and that's that pre-planning. Because our what I'm hearing you say is that our past experiences do color our can color our current situations, and they can influence them and dictate like our just our comfort level with conversations and just with our position that we're in our sexual relationships. But being a bit also open with self can help be open with our partners.
Yes.
It's challenging.
Yeah.
I
Yeah.
think
It's
that's a
hard.
mhm. It's a hard thing, but do you think then, and I you've said it, having that open communication can just heighten your sexual pleasure and
Absolutely.
what you receive.
Yes, right. Because if your partner doesn't know what you want, right, and you never communicate that to them, and you don't tell them that, say you're miserable the whole time where when you're having, sex or being, intimate with your partner, then they're never going to know, right? Unless you
Mhm.
specifically tell them. And sometimes, people really need to be told, or not really told, but really shown, or maybe you express what your concerns are or your desires are, right? And the people are not able to read minds. So I think that, it's so important that we let our partner know so that we both can be satisfied in a relationship, right? So that it's not so one-ended.
So, we're talking a lot about intimacy with partner, right? And out with the relationship intimacy, the intellectual intimacy, I really believe you can have that intimacy with non-sexual partners too,
Yes,
you know,
absolutely.
and can increase the satisfaction of your life, in your life. But there's also intimacy with self. Do you
Yes.
find that it's important to define as an individual what that intimacy with self is like? Um, in my practice, I talk about a lot about self satisfaction in the category of sexual satisfaction for self, so masturbation. But there's also other types of self satisfaction too. So if you have that, this is a long question, I know. I'm kind of prefacing my question, but if you have that, um, like understanding of self, and then you have this understanding with your partner, this intellectual or open communication conversation, do you think that would even make not just your orgasms with your partner, but if you're doing self satisfaction masturbation, does that improve your overall orgasms in that way too?
Sorry, you cut out. So you were saying, um, if you can repeat that?
I was just saying, if you know who you are and you know
Yeah.
who you are within your relationship with your partner, if you're someone who enjoys masturbation, self satisfaction, do you think that would also take that to another level?
Yeah, absolutely. Absolutely right. Because if you know what pleasures you, right, and what makes you the most happy, then you'd be able to tell that to your partner. And I think that that's really what's so important, right? Is that knowing yourself so well that you can guide others. Because again, people don't know. And even in long term relationships, like this woman is in, right, that she's been married to this person for 40 years and is really not looking forward to their anniversary, which I thought was really sad. And
Mhm.
it all boils down to her fear of communicating with her partner, and her fear of, she said she's afraid to leave because of, for whatever reason. But the point is that she's just afraid to communicate. And I think that when we're afraid to communicate, then we're never going to be satisfied. Right?
Mhm.
Because the other
Mhm.
person just will never know what it is that you really want. So when you're able to tell somebody, show somebody what you like, then that ultimately leads to more satisfaction for you.
So I have a lot of patients that are seasoned, and they are in the stage of life where it's harder to, and they've been with their partners for a long time, and let's say they have a great relationship, and they know what heightens satisfaction for each other, but it's harder for them to have satisfaction. It's harder for them to orgasm because of just their physical status. Maybe their partner has ED, erectile dysfunction, or has some medical issue that prevents them from having an erection, and then they also have issues with having the ability to have comfortable sex, penetrative sex.
Sure.
Um, are there other ways that they can orgasm?
Right. So, I just want to go back and, I do want to touch on the question you just said, but, for people that, as we go through life, right, there's so many different changes that happen.
Mhm.
And I think especially for women, right, as women go through perimenopause, they go through menopause, they go postpartum, they've had
Mhm.
babies, all of these things that can lead to estrogen deficiency, right? And so that estrogen deficiency can cause vaginal dryness, and that vaginal
Mhm.
dryness can cause pain with the, vaginal intercourse. And so I
Mhm.
think it's really important when women start to experience those symptoms that they go and seek help with their healthcare provider. And there are so many
Mhm.
options, as you know. There's personal lubricants, there's moisturizers, and there's also vaginal estrogen, right? All of those
Mhm.
things can definitely help improve sexual intimacy with partners. So I think that, as we start to age, and for, people that we are lucky enough to get older, right? Some people are not,
Yeah.
never lucky enough to get older. But that when we start to experience those difficulties, it's so important to go and see your healthcare provider and see how that can help. And also, I think really quickly, what's also very important is that, like you just mentioned, there's so many medical conditions that can also affect our libido, our arousal. There's anxiety, there's depression, there's medications that can
Mhm.
affect that. Birth control pills can affect that. Birth control pills can also affect a person's ability to ejaculate, right? We know
Mhm.
about that. We also know that antidepressants really can wreak havoc on a person's libido. And
Mhm.
so there are calcium channel blockers can affect desire. So there's so many things, medications that can affect that also should be addressed, chronic
Mhm.
conditions, and social aspects. For example, if somebody is working like several jobs, right, they have so many stresses that they're not going to be able to get into the mood of having, a physical relationship with somebody if they're always stressed and they have so many
Mhm.
things on their mind. And we also know that uneven distribution of household chores can also affect a
Mhm.
person's desire
Mhm.
and libido, right? Because if they're doing like 50 things and then next thing they're going to go to the bedroom and try to have sex, that's probably not going to happen because they're
Mhm.
thinking about the dishes, they're thinking about the laundry
Mhm.
that's still there, the clothes haven't been put into the dryer, like so
Mhm.
many things. And then
Mhm.
all of a sudden now you're supposed to have sex. Well, that's not happening, right? So I just think that, and that's where mindfulness also comes in, right? So if we're
Yeah.
really present in the situation that we're in without judgment, that automatically will help increase desire and arousal. So I just kind of wanted to mention that because
Yeah.
those things. But yes, like you talked about, you wanted to know, is it possible to have an orgasm without penetration or clitoral
Mhm.
stimulation? And
Mhm.
definitely there are ways to have orgasm without penetration, because there are other erogenous zones, right, that you can have an orgasm. So erogenous zones really can be anywhere in the body that's sensitive to touch, stimulation. And, that can include, like, for example, like the nipples or the nape of the neck or even the back of the knees. Different people have different erogenous zones and areas that are sensitive. And so when stimulated, those areas can cause a person to have an orgasm. So I think that, people would really need to just experiment and see what they like and the different types of touch that they like, and then see what works for them. But yeah, there definitely is other ways to have an orgasm.
Thank you for saying that. So you're telling me that if you're in a couple and you are into your older years and there is something that has prevented one member of the couple or both members of the couple from being able to have sex where there's penetration, or for some reason when you have clitoral stimulation, you don't have increased sensitivity, with that open conversation that you so wonderfully detailed on why we should have it to improve our intimacy, you can still have um, very good, very satisfying orgasms, and
Absolutely.
that's something that can
Absolutely.
be explored.
Absolutely. And it's really important to do that, especially because there are people with chronic conditions, right? Chronic medical
Hmm.
conditions that
Hmm.
may not be able to have penile vaginal intercourse or, clitoral. For example, there is another physician that I know that speaks a lot about the clitoris, and she talks about clitoral phimosis. And
Hmm.
sometimes when that happens, right, you get like adhesions around the clitoris.
Hmm.
And, those people can be anorgasmic or
Hmm.
can have muted orgasms. And
Mm-hmm.
so then, how do you deal with that? Well, you go see a specialist, and perhaps they can take down those adhesions around the clitoris so that they can, a person can experience like the clitoral orgasm. But for some reason, if that doesn't work, then there are other, areas on the body, different erogenous areas that can also be stimulated where people can have an orgasm.
What would you say in this country we should do as a nation to help improve the education of sexual health?
Oh my gosh, you are now speaking to my like that is the core of my existence right now. So I have spoken a lot about comprehensive sexual education. And so I did a whole webinar on that. And really what, and there's so much to it, in fact. So it's funny. I'm so glad you asked. I have so many thoughts about this. So I think really what happens is that even though sex is all around us, right? In magazines, in
Mm-hmm.
media, in commercials, in everything, subtle or not so subtle, it's
In
all around us.
cartoons.
And what?
I said in cartoons. I even see,
Yes,
references
cartoon.
and movies for, with my young children, and they're
Yes, yes.
GPG rated,
Everywhere.
but
Yep, you're right. Absolutely. Everywhere,
mhm,
right? But the irony of it all is that we have so much sex negativity, right? So in general, there's sex all around us, but when it comes to like say person to person individual levels, there's a lot of sex negativity. I've had physicians that are very, very uncomfortable having discussions about a patient's sexual history, right? They
yeah,
just don't ask, they don't want to know, they don't know how to deal with it. They
yeah,
don't know the questions to ask. They're afraid of the answers and they don't have the answers, right?
yeah,
We have in medical school, we're not being taught. In residency, we're not being
yeah.
taught, right? So where are people getting the information? People are getting information either from porn, right?
Mm-hmm.
And porn, they don't understand that porn is, it's theatrics. It's,
Mm-hmm.
people, that's their job, right? So they are acting. So if people are going there to watch a show, then that's a show, but it's not reality. There are people that I've heard of, family friends whose children are now getting married, who are their marriages are being, divorced. They're getting divorces in like 4 months because they're not being satisfied
Mm-hmm.
based on what they've been watching the whole time, right? And so what their expectations are way different than what they go into a marriage expecting. And so,
Mm-hmm.
what you were asking about, like, what would I recommend for comprehensive sexual education? Well, there's so much to that because each state actually gets funding for sexual education. Okay. But whatever is taught in that school is based on the district, it's based on the people in that district, it's based on, say, the PTA, right? That's deciding
Mm-hmm.
what's going to be taught in that curriculum. There are curriculums out there that are not teaching, LGBTQ because they think it's
Mm-hmm.
ruining their kids. There are people, not even, you don't even have to talk about the LGBTQ community. There are communities that are not teaching contraception. There are communities
Mm-hmm.
that are not teaching, they're teaching abstinence, which is
Mm-hmm.
fine, but you need to give people options. You need, because
Yeah,
that abstinence doesn't work. If it
yeah.
worked, we wouldn't have so many unplanned pregnancies that people don't want, right? So there's so much there. There's so many layers of the onion to peel back, because for comprehensive sexual education, you need to have evidence-based, science-backed research, research-backed medicine and education that we're teaching our children, right? To help them have agency over their own sexual lives. And if they don't have the education that they need to make their own choices, then they're going to try to get it from somewhere else. And that information may not be correct, right? So it
Mm-hmm.
really behooves us to teach our children correct information about what happens. And nobody's saying you have to teach children, right, when they're like 2 years old. But I think that what should be taught when kids are younger is um, proper names, like, the
Yeah.
correct anatomical names of their, genitalia, so that they know. So for example, if they, God forbid, ever got molested or something happened to them, they would be able to tell you exactly, what happened, as opposed to saying somebody touched my cookie or something like that,
Yeah.
right? Like a
Yeah.
euphemism that they're hearing at home. And so then if you hear a little kid say that, you'd be like, oh, it's okay if they touch your cookie, you can touch their whatever. You know
Yeah.
what I'm saying? I mean, the point is to be, accurate when you have these discussions with kids, and so that they know how best to, make choices. And when they don't know, then they are able to go to an adult that
Yeah.
may have more information than them, and that can help guide them, right? It's not about making choices for them, but it's giving them information so they can feel empowered and educated to make their own choices.
Well, and they're growing. They are children today, they are adults tomorrow. And so
Absolutely.
teaching things in the appropriate, for age appropriate, right? But teaching things at the appropriate time in the appropriate way is important to build character and well-founded adults as they get older. And so I don't know the studies on this, but the correlation between having very poor sexual health education in schools to unwanted or unplanned pregnancies, the correlation between having poor or little sexual health education in schools to STD rates, you know, there's a correlation there, right? Because to your point,
Absolutely.
people are
Absolutely.
looking to falsities for their education. Um, porn to real sex is like staged wrestling to the Olympics. It's fake. It's not real. And there,
Right.
and somebody, I can go on a soapbox, but somebody having sex 8 times in a row with no lubricant, no sleep, they're not enjoying it. This is not real. So that should not be the litmus test for how somebody should perform in the bedroom, right? And so, not that that is where you're going to start with a child that is in fifth grade, sixth grade, seventh grade, or whatever, younger or older. You're going to start where they need, which is anatomy,
Yeah.
and talking about
Absolutely.
that, talking about the
Absolutely.
reproductive system, how that actually works.
Yeah.
We are giving them agency over their sexual lives, but we're giving them agency also over their bodies, over their minds, over their sense of self. And I think that in our generation, I'm on a soapbox now and I'm going to stay on it. In this generation, that agency over sense of self, even though we really try to say that it's really there, we're telling people to be who they are, they're losing it. They are really losing the agency of who they are as individuals. And a lot of young people are taking on who I should be because this is what society says I should be.
Absolutely.
So
Absolutely. Wow.
sorry for going up there, but I think I love
No.
our conversation. I really think that's you made some very key points that's important for us as adults, us as parents, us as community of people to be able to hear and understand. In our last couple of minutes, um, what are some things that you, as a when we talk to our patients, it's nice to try and talk as ourselves, right? We're physicians. We have a lot of education and a lot of good things that we've done, a lot of credentials, but we're people, we're women. And so there's that connection that you want to have with your patient. What are some things that you yourself feel comfortable in sharing about your path to where you are as a woman?
In terms of,
In terms of confidence of self, confidence in being, because
yeah,
it's not easy. We were just talking about
yeah,
residency before we came on air
yeah,
and how honestly brutal it can be. And you had a wonderful patient experience today with someone that's been your patient for a while, but sometimes being in those rooms can be brutal because we can be torn down, oftentimes more than built up. And when we're torn down, who is there to build us back up? We're people.
right.
So if you had to share one thing about yourself that you do to help build yourself up and keep yourself going, what is that one thing?
Yeah, you know what I do is I try to, and it's not always easy, is I try to do positive self-talk. And I think that that is really important because a lot of times, so there was a book that I read in December. It was called Soundtracks by John Acuff. And he talks about the book is called Soundtracks because it talks about the things we tell ourselves over and over again.
Hmm.
And we don't realize it until it kind of becomes like a soundtrack in our head, right? Like, so we can say to ourselves, like, oh, well, this isn't working because I'm just not good at this, or I'm not a very good speaker, or I'm not this, I'm not. And we start to tell ourselves so many negative things that we start to believe them. And then we just, play ourselves very small, right? Because we just are starting, then we start to lack confidence in ourselves. And so, what I've been trying to do more and more is to speak more positively to myself and, say things that would encourage me to me. So as if I was speaking to a best friend, right? Because oftentimes we're most critical of ourselves and,
Yeah.
speak very negatively to ourselves, but, we'll really encourage like our best friend or our child or somebody else. So I try to be my own cheerleader and know that if I don't believe in myself, then nobody else is going to believe in me. And so it's so important for me to have that self-confidence and to be really kind and compassionate to myself. And so that's what I've been practicing more and more, and to try to have those positive soundtracks in my head instead of negative ones.
Positive soundtracks. I'm going to keep that in mind for the rest of my week and the rest of my month. I think that's beautiful. Dr. Sadaf, tell us how we can get a hold of you for those that are viewing, those that are not as lucky like to live in New York. How can we get in touch with you? How can we be a patient of yours?
Yeah, thank you. So, I do telehealth for gynecology in the states of Michigan and New York, but for coaching, it's national, it's international, and I actually have a patient in Saudi Arabia. So I do have patients internationally, clients internationally for coaching, and that's for intimacy coaching. And so you can go on my website at drsadaf.com. You can email me at drsadaf@drsadaf.com, or you can even DM me on Instagram and TikTok at Dr. Sadaf OBGYN. I also am on YouTube, and I also have a podcast called the Muslim Sex Podcast.
Thank you so much. I appreciate you. Such a
Yeah.
wonderful conversation. Thank you for being with us tonight. And this is Climax After Dark.
Thank you so much. Thank you for having me on. I appreciate it.